All right, well, welcome everybody to the Archimedes Grand Rounds seminar series. I'm your host and moderator, Kevin Fu from Northeastern University, and also the director of the Archimedes Center for Healthcare and Medical Device Cybersecurity here at Northeastern University. So just a few reminders as we get started on our monthly seminar. The seminar series happens every third Thursday of the month during the academic year. And for those of you who are not on the semester system, this is the last webinar of the academic year before students go on summer break. So today will be the last, and we'll resume in September. Again, I'll be your host and moderator today. And if you'd like to connect with me, you can find me on LinkedIn. A little bit of housekeeping before we get started. There will be a Q&A button at the bottom of the Zoom window if you would like to submit a question for consideration. I would say keep your questions to one at a time, and we'll be looking to spread around the questions to different people. Appreciate any kind of questions, but if you ask multiple questions, you should not expect to have all of those responded to. Don't try to use the chat button. We aren't using chat in this seminar just because the forum is too large. So thanks for using the Q&A button instead. And we always get a couple questions each time. The first question is almost always, will the slides be shared? The answer is yes. And this month we've decided to enhance this question with, if you ask, you will buy a beer for everybody on the call. So that gives the incentive system for a couple hundred beers. So there you have it, the answer. Yes, the slides will be available. You'll see a video capture on the secure-medicine.org website. Keep a watch there. And if you have questions, you can always mail Archimedes at northeastern.edu. We would like to thank our corporate members for the Archimedes Center, and we especially like to thank MedCrypt for providing generous support for this seminar series. So Archimedes hosts a number of events and forums. We host events throughout the country. That's a combination of training and what we call Medical Device Security 101. And we also like to bring in new speakers that many of you may not be entirely familiar with. And we'll get to that in a moment with our new speaker, Matthew Scholl, in just a moment. We'd also like to do a couple announcements. So we have a large group. We have about 50 students, faculty, software engineers across various projects. We're about 22 million in medical device security research projects and classroom activity and research. And on that note, we wanted to let the audience here know, in case they're looking for work, we do have a few job opportunities available, and you can find this by, I'll put this up so you can click the QR code, which will just take you to this LinkedIn URL up on the screen. But this QR code will bring you to two different job postings. One is a permanent position for events planning and digital marketing in the healthcare and medical device cybersecurity regime. You can learn more about that through the LinkedIn post. And then second, for folks who are thinking about, oh, let's say career development or a career change, or maybe you're a student just starting off in the industry, well, we've got an opportunity for you. This summer, we're building up an interdisciplinary cohort of students, faculty, medical device manufacturers, biomedical engineers, clinicians, and cybersecurity researchers to contribute to a whole hospital simulator that we're building as part of something called the Patch Project. And again, you can read more about that from that QR code. All of these opportunities are open at the moment. Those who can apply by the 26th will receive full consideration, but encourage you to submit if you'd like to be fully considered. Make sure to read through that submission process so you follow the directions. And those are the two opportunities we want to make sure you are aware of. So we've been holding this seminar series for, I want to say, I need my Andy Rector, but I think something on the order of 3 years. Maybe it's been 4 years. So we've had many speakers coming through, and we keep an archive of all those videos. And today, it's my pleasure to invite to the program Matthew Scholl. So Matt and I have known each other for, I forget, has it been 200 years? Or 220 years. But uh, Matt was previously the chief of the NIST Computer Security Division, and many of you will know this division. If not by name, you'll know them by outcomes, and that is uh, they have the remit for cryptographic standards in the United States. So they do cryptographic standards making and development and cybersecurity research. So if you've ever heard of an algorithm called, oh, I don't know, AES. Well, it came through that office. Random number generators come through that office. Any kind of encryption. If you'd like to sell a product to the U.S. government, well, you need to meet the encryption standards that are run through that NIST office. They also host all those competitions for new cryptographic algorithms. Matt has moved on from NIST and is now an independent consultant and an ISO 1725 technical auditor. So I've asked Matt to come in today because he gave a private conversation with our Archimedes corporate members some time ago. And our medical device and healthcare delivery members had just so many questions for him. And so today's talk is titled Standards and a Side of Post-Quantum, How It Works. I wanted to add the emojis of some bacon and eggs here. And many of you have heard about quantum computing. And Matt is going to demystify that today to tell us about what's the world of post-quantum, when there are things that can use quantum computers to break encryption, what do we do about it? And how might that affect the medical device manufacturing community and healthcare delivery organizations? So without any further ado, I'm going to stop my sharing and cede the slides to Matt. So just hang on a moment. And I will let Matt take it away.
All right.
Thank you, Matt.
Thank you, Kevin. That list of previous speakers was daunting and intimidating, but I shall do my best. And I will talk about both standards and post-quantum encryption. I'm one of the strange and rare people who does get excited about working with and amongst different standards and standards bodies. Let me see if I could figure this out. And I can. Pow. Okay. You see a big wheel and a scary statement that says standards are everywhere. Veronica kind of, when I was previewing this, said, that sounds a little scary. It is not scary. There shall be no scary today. Well, maybe a little scary at the end for you. It depends. So I'm going to talk about standards, the importance, the impact, and how standards are done in the U.S., and then the shifting standard that's coming to us in the encryption world around post-quantum encryption. So let's talk about that. As Kevin said, we are rapidly approaching into the holiday weekend. I love this time of year. This is the time of year that we like to call Nerd Spring. First of all, March 14th. I can't see anybody, but we all know what March 14th is, right? Everybody? Anybody? March 14th? Pi Day, right? It's a good nerd day. We're going to increase our nerd level here. May 4th. Anyone know what May 4th is? May the 4th be with you is Star Wars Day. They roundly celebrated in my household. All right. Apex Nerds. Just this week, what was May 20th? May 20th was World Metrology Day. I'm sure you all celebrated heartily, as I did, and World Metrology Day. It's where we celebrate and reaffirm the international metrology agencies, all the different countries, our implementation, use, and our mutual recognition of the international standard base units. And there they are across the top: the second, the meter, the kilogram, the ampere, the Kelvin, the mole, and the candela. All measurements are based on those SI base units, and those form the foundation for all your measurements, all your calibrations, much of your documentary standards, and many of the things that you as medical device manufacturers or medical providers are required to calibrate to or provide assurance that you are accurate about. So these base units, managed and maintained by the National Institute of Standards and Technology for the United States, form a foundation from which we build more complex abstractions and then become the basis for interoperability. There's a standards joke, which you will not find funny because it's a standards joke, that a 747 is basically just a set of complex standards all moving together at the same vector and at a high velocity. And the only way you can get a complex machine like a 747 to come together is to have a set of standards all the way down to base units like SIs that allow for a very large supply chain and a very complex set of manufacturing to abstract out, and then when they reassemble to be interoperable. So this is incredibly important. What this means is standards, not just SI standards, but all the different types of standards like documentary standards, and I'll kind of go through what these different standards are besides SIs and documentary standards. These basically are trust foundations. And with standards, you have the capacity and the ability then to, like I said, build these more complex systems with an assurance of interoperability and conformance to requirements that you need. With that type of trust foundation and that abstraction, then you don't have to worry about some of these needed base things. You can focus on the more pressing issues in these complex systems that you got. We all go to the gas station every now and then. I'm sure when you go to the gas station, especially recently like me, you look at it and you're a little shocked. But if you're a standards nerd like I am, one of the things I always do when I go to the gas station is, it says I got a gallon. Did I really get a gallon? Is a gallon of gas really coming out of that pump, or is it less, or is it more? We extend trust to a lot of these core measurements just inherently, without even thinking about it, without knowing what the source is. So when I go to the pump, I'm not looking necessarily at the dollar amount. I'm looking at these stickers, these certification stickers that come from, in the state of Maryland, the Maryland Office of Weights and Measures, saying that this pump has been tested and calibrated and found correct within the margin of errors that are acceptable by the Office of Weights and Measures for the dispensing of fuel. Very similar to you as a product manufacturer, as an example, for any type of certification from an accredited organization, be it a testing laboratory, a calibration laboratory, or a local government office that certifies your product as being correct for the dispensing of whatever that SI value is, right? Little more standards, lore, and nerdness. You've probably seen the Nate Bargatze Saturday Night Live skit where he talks about, in America we have a gallon, and in America we have a foot, and no one knows what these are or why we have them. But the truth is we do know in America why we have a gallon and a foot, and the answer is, of course, pirates. And that seems like a strange answer, but what actually happened way back in 1794, the Secretary of State, who was Thomas Jefferson at the time, actually sent to France to get an official version of the meter and then a combined volume and kilogram weight and volume standard reference from France. France was, and up until very recently, was the source for SI units. You would bring your SI to France, compare it through a state of comparative metrology, make sure it was tight and close to theirs, and then bring it back to your country and then use that for your nation's calibration. So 1794, we were bringing home the meter and we were bringing home the kilogram, but sure enough, pirates jumped that ship, took the meter and the kilogram down to the Caribbean. The French scientist who was bringing it to us was imprisoned and was being ransomed and died in prison, and that meter was never found again. And so we stuck with the foot, and we're stuck with it today. So you can thank pirates, and that's the answer to that Nate Bargatze skit. Standards allow for scale also, not just for interoperability, and lots of different both standards organizations, ISO, ANSI, the Internet Engineering Task Force, the IEEE, the Trusted Computer Group, and OASIS, but also different types of standards in those different types of organizations. Um, some are national, some are international, some are technically based. And each one of these has different missions, different objectives, and different rules by which they operate. Boop, there we go. Okay. The important thing about standards is that standards are nice, and there's lots of standards, but unless they're trusted, they're not going to be used. So in order for standards to have a basis of trust, in the United States, the philosophy is public industry input, traceability, and transparency in those standards is incredibly important so that the standards have traceability, if needed, all the way back to those core SI units, but that they're trusted and understood. Without that, you're going to have a lot of standards, and we do have a lot of standards. The ones that are used often are the ones that are trusted. Another great standards joke here, talking about lots of standards, right? Okay, so I've used this word standards a lot in this talk so far. One of the main ones I've talked about so far, bottom left, states and weights. You see the person in the lab coat and the gloves. They are actually holding what's known as the kilogram. Up until very recently, actually, it might have been, I think, 2018, 2017 timeframe. In the United States, literally, that was the kilogram. We used comparative metrology. That kilogram would be brought to France every 10 years, compared to the French kilogram. Made sure it was the same, because every now and then they'd off-gas atoms or they'd gain dust or whatever, and then brought back. And that kilogram there was what was used as the source for all weight calibrations in the United States. We don't do that anymore. There's a scientific method using a watt balance for the kilogram now. You are probably most familiar with measurement and documentary standards. Documentary standards are the ISO, the Internet Engineering Task Force, AMI, for medical devices as an example, where industry, government, other individuals come together to form standards to achieve a purpose, generally for interoperability, or standardization of technology for market. You also probably are very familiar with calibrations and accreditations. As medical device manufacturers or participants in the medical device industries, you are probably responsible to having a device calibrated or accredited to a standard. So there will be a standard cited for which you will have to provide evidence that you adhere to the standard. Sometimes you can do that yourself through a self-declaration of conformity to the standard. Sometimes you are required to go to an independent organization, laboratory, to have that device verified that it meets those standards. In the US, then, there's an organization that accredits those calibration laboratories to do those tests as well. So people check the checkers, then the checkers check the product or the service, and then the product or the service then is verified that it adheres to a standard or a specification with a certain level of assurance. Now, nothing is perfect or pure, so there's different levels of assurances that a test or calibration can assure as well. And there's other types of standards. There's materials that you can verify or validate a product against, called standard reference materials, and then data as well. So these are the different types of standards that generally are at play in our standards ecosystems. Oh, I used that word, ecosystem. Sorry about that. I talked about interoperability and technology, but people participate in standards for a lot of different reasons, and you do as well, as much for a business and a competitive and a market reason as a technology reason. Sometimes not the best technology solution is the one that gets squeezed out of a standard because businesses have business reasons. Could be for product or product legacy, could be for the ability to either stay in or open a new market, or to work to stay competitive in a global environment. So there are other issues besides just good technology that come to place when you participate in a standards body. But as I said earlier, I believe and I am an adherent that standards are good. They're not just good for interoperability, they're good for scale. They're good for market access as well, because when everyone plays in standards bodies by the rules, and when open, international, accepted standards are what are cited for requirements, then that does give you access to markets that might potentially be locked out if local or even proprietary non-public standards are used for certain products. And we do see that sometimes in certain areas. But there's other specifications of what is good. All right, so what is good? In the United States, this is a citation from a document called OMB A119. OMB A119 outlines for the United States federal government what standards are, how the United States government uses standards, how the United States government should use standards in regulations if they are to regulate, and what the United States defines as a good standard. And these five things basically define what a both good standard and, as importantly, a good standards body is. It should be open to allow for participation. It should be balanced, meaning it should not be swayed by a single market, country, or industry. There should be a known and fair due process for the creation of the standard. There should be an appeals process when needed, and the standard should be based on general consensus of either the standards body or the working group that's developing the standard. There are standards bodies that the U.S. does participate in, the U.S. government participates in, out of necessity, that do not necessarily follow this open, balanced, due process, appeals, and consensus model. There is treaty-based standards bodies that aren't necessarily open because they're only for nation state. There are standards bodies that are closed to just certain governments or sections of certain governments. If you think of something like a NATO standard. And again, the U.S. participates in them generally out of necessity, but this is the default when the government is going to participate in the standard. We ensure that they have these qualities to them. The policy in the United States and for the U.S. government as well is the U.S. is a market-based economy, and we look at standards as a market multiplier, and we follow that as per U.S. policy, meaning the U.S. government wants industry not just to participate, but to hopefully lead in standards and standards activities, and the government then is just another participant. The government should use and cite industry-developed standards in the technology it calls for, and or, like I said earlier, if they are going to put constraints on a technology through regulation, they should use standards that are industry designed and industry developed. The United States is a bottoms-up standards organization policy as well. United States government does not drive or require standards unless the market has proven itself to have failed in a way that requires the government to protect life, health, property, economy. We will let the market work it out. So often standards in the US, because of this, is kind of a scrum and a bit of a crazy, ugly game. There's a lot of different competing and different, even non-interoperable technologies that will emerge until a market potentially selects one. And then generally then standards will form around that to allow for a supply chain or a larger market participation. This is how you get things like, uh, you know, Blu-ray versus, HD DVD type of thing. You let them fight that out, and then you figure out who wins. Um, Many other countries do not follow this procedure. So I remember when I started working as standards, I just thought this is how everybody did it. It is not. In Europe, and you might know this even better than I do, in the EU, it's very top down. The EU will regulate first, potentially even before the market has taken an opportunity to address something in technology. The EU will sometimes regulate and cite standards that don't even exist yet. They will say, you're going to follow this privacy, security, interoperability standard that then will be developed by Sensenelec or ENISA. And so they will do a very top-down regulatory first control. They will cite standards, sometimes standards that don't even exist, but then direct their European standards agencies to develop those standards. Very opposite from how the United States does it. In Asia Pacific, most of our Asia Pacific allies kind of follow our model or general participants in many of the different standards bodies. But China is a unique situation where it is very centralized and state driven. And for years, also, China has done a thing where the government has incentivized academics, industry, and even individuals to participate in standards bodies, generally by paying them to attend. And not just paying them to attend, but they would also receive potential financial bonuses for standards submissions as well. Now, the intent there was to incentivize and grow China's participation in standards and the recognition that standards are long-term technology and technology dominance as well. Some of the downside has been, in order to grab those incentives, a lot of like silliness sometimes happens in standards bodies where people are moving semicolons around, changing fonts, and really not being substantive in their inputs in order to obtain those bonuses. Something I will say, though, long term, what it's done, though, it really has trained and exposed a lot of people from the PRC and how international standards bodies operate. And so they have grown a cadre of people who are familiar with the process. So in the US, we continue to try to encourage people to participate in standards, not just because it's potentially good for your business to know what is coming for interoperability and or potentially conformance reasons, but also to do your best to represent your market, your industry, and even your individual businesses in what is generally and should be considered a place where markets develop. So the U.S., we're kind of unique. We're bottoms up. In the U.S. government participates with industry, but industry leads. Very different from how EU and China run their standards activities. Conformity assessment on the United States is also different than how the EU and China conduct their conformity assessment. Many of the countries as well. It's easier in the other countries to have a national level coordinating organization because most other countries are much smaller. But there is no one organization within the United States that coordinates and harmonizes across all the different types of conformity assessments. This probably makes you, as an organization who has to conform to different requirements, a little bit nutty. But this is how it works. Many sectors develop their own approaches. The technology sector has a couple of different approaches for conformity, be it things like the Wi-Fi Alliance or the TCG or the IEEE. Healthcare has its own sector approaches. A lot of safety and OSHA and PPE devices, as an example, have their own approaches. Um, a lot of these are done by the sector where industry comes together outside of government and as a market in order to protect their market and protect name, reputation, product of the market, then do their own internal conformity assessment. And this alleviates the need for the government to step in. It's much easier and cheaper for the government, easier and cheaper for those then who participate in an industry-led conformity assessment scheme as well. Um, Often, as one of my bullets there, the downside is there's overlap in coverage. It is not uncommon for you to have to potentially express conformity to multiple different um, suppliers, vendors, customers, um, while you're doing the same general core activity, that foundation piece, but they may be asking it from different viewpoints of different standards, abstractions. Yeah, sorry about that. That's just how it is. A lot of different ways you can express your standards conformance, and I talked about this a little bit earlier around um, the level of assurance that you're going to get in the expression of conformance to a standard. Um, you see two kind of big fat arrows here, increased confidence and then independence in the rigor of activities, all the way to one side of there. And the smallest is the supplier declaration of conformity. This is a kind of generally accepted theme where you self-declare that I'm good. I conform to ISO IEC, 17025, or I conform to IEEE, RFC, whatever. Um, in some of the new, for example, IoT trust mark from the government, the initial ones are vendor self-declaration of conformities. You're saying, I declare that I conform to the IoT trust mark requirements. Um, that is, in my opinion, a little bit rigorous because you are not just declaring conformity to the technical spec or the standard, you are actually taking a business risk by saying, I, as a company, I, as a vendor, am declaring that I'm conformant. Whereas you get to testing by first party or even testing by third party, you get to abstract that business risk away. So there's an independent verification of your product, generally could be done on site at your location or in the testing laboratory. There's a lot of different ways it can be done. But now that testing body is the one that is providing an assurance that your product conforms to the standard. So if something happens to your product, you can be, hey, that lab said I was good. I'm not sure what happened here. And so there is an abstraction of business risk when you get to second and third party certifications. Second and third party certifications, and you're probably, again, more familiar with this than I am, especially in the medical device arena, can be done pre-market. It can be done post-market. It can be done individual product. It can be done statistical sampling. It can be done continuous. There's lots of different ways it can be done depending on, again, the level of confidence, basically the level of risk that will be accepted if the product doesn't conform. Medical devices, pretty important that they conform because the risk of nonconformance can be catastrophic, life and limb. So there will be harder requirements generally on products that require much lower risk to nonconformity. One of the more difficult things in these types of conformance schemes is not necessarily getting onto the list, conforming and saying, I do conform, but the specifics around conformance maintenance. So I push a software patch that has some applicability to the scope of my conformance. Am I still certified? Am I not? How much change then requires retest or recertification? How much doesn't? How long is a conformance valid for, or is it not? Even organizational things. Product changes hands. Product is no longer supplied or supported. Are things then still allowed to keep your conformance certification? The conformance body who is doing the testing or requiring the conformity, perhaps even the industry body, should be laying that out in their scheme. A certification is good for 3 years or 5 years, and then it requires a recertification. If a certain area when the scope is changed, it requires whatever it is, but that should be detailed within the scheme. So it's flexible and it's conformance implementation from you don't even need it, vendor self-declarations of conformities, all the way up to third-party testing, third-party certification, and things like approved product listings. Generally, the more you go to the right, also, the longer these things take, and the more expensive they get for everybody involved as well. Whoop, I went too far. Okay. So I talked a lot about standards, and I talked about these SI units, right? My frowny face here is, we're here talking a lot about cybersecurity. There's no cyber SI on that wheel. There is no foundation for security, unfortunately. So when you break down your security abstractions and complexities that you've built, and you look all the way deep into what are the assumptions that you're making in your security control, what are the assumptions you're making about logging? What are the assumptions you're making about access control? What are the assumptions you're making about side channel protections? Or what are the assumptions you're making about isolation? When you break it down, they come to a very few, very low level items, not quite SI level, like a kilogram or a second that you can base on a physical item. I mean, a second is based on counting oscillations of a cesium atom. But there's a very few items that get broken down that you could kind of consider to be a cybersecurity SI. And as Kevin alluded to at the start, one of the major ones on which almost all of our cybersecurity abstractions depend on is encryption. And like Kevin said, we've got good encryption standards like AES. So thank goodness we've got good standards for encryption. But unfortunately, that encryption and about half of your cybersecurity SI bedrock in cryptography is about to shift. Most of the cybersecurity standards for key establishment and key exchange and for digital signatures are about to be deprecated by the United States. As of right now, as of today, the deprecation schedule, deprecate is a fancy word for we're not going to let you do it anymore, is 2035. Now I have a little note there. 2035, right? I'm not going to be here by 2035. I'm going to get back to that. So whether or not you believe a quantum computer is going to be built strong enough in that time frame or not, to some extent it really doesn't matter because the United States government is going to not allow non-post-quantum encryption algorithms for securing data after 2035. So if you want to do business with the government, and part of the government is going to require you to have adequate security, be that HHS, Office of Civil Rights, OCR, through a HIPAA rule, or through the DoD, or the VA, or whomever, a requirement for encryption will require PQC encryption. No more Diffie-Hellman, no more MQV chems, no more digital signature algorithms, no more elliptic curves, no more ECDSA or Edwards DSA. These all need to be replaced. as Kevin said, the issue is this emerging quantum computer. We've got quantum computers now. They're pretty much test bed and pilot. There's a couple of different types of technologies that are implementing them. It's that kind of technology scrum space we're in right now. So we're not exactly sure which of the quantum technical implementations is going to be the best. Standards are just starting to emerge to help with not just interoperability, but for supply chain to help build out these quantum machines at scale. We do not have a quantum machine yet that can break our public key encryption. I'll tell you, I don't think we'll have one by 2035, but that's not the point. The point is, the threat is, and you've probably heard this, harvest now, decrypt later. Bad guys are sitting on our wires and they download everything. They're downloading your encrypted data. What they first hope that you're doing is that you're not even up to Diffie-Hellman or DSA. Maybe you're using DES or MD5. Bully for them if you are, because then they can break it in real time. If you're not, they just sit on it and wait. And so if you have data that's still going to be valuable, important, or impactful into the future, then you need to keep that data still encrypted into that future. So when you think about encryption, you need to think about it as the last day it needs to be kept confidential rather than the first day that you encrypt it. So 2035, from the government perspective, when the government thinks about secret data of a 20-year secret requirement, we're betting a quantum machine won't be around before 2055. That's, in my opinion, not a good bet. So 2035 is the timeline for the government. If you're looking at harvest now, decrypt later threats against classified information of a 20-year life, that's kind of late. So yeah, we're going to be gone, dead, fired, replaced by AI. No. We're already kind of late. Not only are we kind of late, our history in doing crypto transitions, which is why some of us, not you out there, but others, are still using DES and MD5, is because transitioning this type of encryption is difficult. There's supply chain, there's hardware, there's dependencies, there's design, there's cost, there's expense. Our experience is these are 5 to 10 year processes to get done. So I certainly hope in your organization, even in your products that you're providing, you have a path forward to implement the new and existing standards that are PQC accepted right now. We have FIPS 203, FIPS 204, and FIPS 205. These are the new encryption standards that will replace those chems and digital signatures that will be vulnerable. Implement them now. Do not wait. Land them in your product line. Talk to your suppliers. Talk to your customers. Please start the process for transition so that 2035 is something that can be achieved. There's a lot of guidance out about how to transition as an enterprise as well for your company. But a lot of that also depends on your product that you're pushing out as well. So we need you to do both. We need you to start now. If you don't know how, you can go to the NIST website. And again, there's transition guidance, processes, draft plans, and communities that you can join to discuss best practices for starting, cost estimating, and then conducting a PQC encryption transition. This is something that's going to have to happen at scale. Like I said, the United States has declared 2035, even though I was a little down on the EU and their standards activities. The EU has also said, we're using these, we're 2035 as well. So as the UK, Japan, Korea, Australia as well. So pretty much the global governance community from a government perspective is on board and pushing the 2035 date and stating that these specs are acceptable in order to maintain your security conformance going forward. Okay, a couple of sources that I pulled for there in the talk. Kevin, I'm going to stop sharing. I've been blathering on for a while there. So if you took anything from my talk, pirates, 1794, those bastards stole our meter and never gave it back. All right. Who's got questions?
All right. Well, thank you, Matt, for the entertaining talk on a serious subject. It looks like our first serious question is about the definition of a standard, and this gets into FDA. So
Yeah.
I realize you don't represent FDA, but imagine you do. Um, how is this going to affect things with when as it pertains to FDA's scope of medical device security, investigational devices, standardization, and it's called pre-market notification, sometimes
Hmm.
pre-market approval. How do the NIST standards percolate into other agencies of government that,
Yeah.
well, in FDA's case, is pre-market?
Yeah. So how NIST works with an organization like the FDA is a couple of different ways. One of the things that NIST would do, NIST has an organization called the National Voluntary Laboratory Accreditation Program. That part of NIST would work with FDA in setting up that certification scheme. So they would go to the FDA and say, all right, talk to us about your risk tolerances and what is it that you're trying to do. And based on that, then there, a discussion would occur and they would say, all right, sounds like you're trying to do a pre-market certification. NIST would talk to the FDA about different models of pre-market certifications. One of the big things that we would generally talk to an agency about is especially the governance that applies to something like a pre-market certification. As you are well aware, these things are not small. They're onerous. They require a lot of resources, and they require a lot of expertise. We will highly recommend to an agency that they use an existing governance organization for this. And by that, I mean like use ANSI, use ISO, use IEEE that has a set of established rules that I pointed out earlier that meet the requirements in A119. They're open, they're inclusive, they've got a redress process, they have consensus based. Use that already established governance in order to force conformance to your requirements. So we would recommend to someone like the FDA use an existing standards body, not just in citation of those standards, but also in the conformity assessment of those standards. When possible, use an international one so you get mutual recognition. I'm sure you would love to have to go and get an FDA US certification and then also get an EU one and get a UK one and get an Australia one and get a Korea one. Rather, hopefully get one and that has some level of international MRA to it, so that you only have to spend that once and then have the accessibility to many markets. Sometimes, if the standard does not exist that is needed, the FDA or any other federal agency then has one of two options. They can start a working group in a standards body and ask industry to come help them develop the standard there. Or there is an exception and they can say, nope, we're just going to say we are creating a standard or we are going to require something that is not necessarily industry-based or industry participative if the standard does not already exist. So that's generally how it's supposed to work. Things like encryption or cybersecurity, the FDA, and we've worked very closely with the FDA in the past. They know that they are the experts at food and drug, or devices and radiological health. They are not the experts in cybersecurity. So they will come to NIST or CISA and say, what should we cite? What should we do? And they will sometimes, or sometimes even more than sometimes, cite NIST specs or NIST standards. You see this especially in something like the HIPAA rule. Most of the HIPAA requirements say, here's a NIST spec. If you do that, then we believe you adhere to the rule, type of thing. That was a very long answer, Kevin. I don't even know if I answered it.
All right.
Okay.
Um, we've got some interesting Chrome extensions. Let's see.
Yeah.
So we have some more questions. Before we get to that, I want to take this opportunity, since we have you on the line. 2012. Picture this. Back in 2012, there was the NIST ISPAB meeting, and there was a letter written on medical device security.
Correct. By
Um,
you, sir.
oh, shoot, you went to the punch.
Oh, I'm sorry.
But I was wondering if you could just paint a picture of trying to connect the dots all the way to post-quantum, but what was the state of affairs back then, and
Yeah, it
any
was
thoughts you might have?
the state of the affairs back then, even though it was 2012, and for some of us old folks, that seems very recent. Things were very rigid back then and inflexible, if it existed. So you kind of had kind of two areas. One where there was no cybersecurity whatsoever, potentially, or on the other side, there were cybersecurity requirements, but they were so rigid and so inflexible in their application that you would sometimes get a negative effect where someone had to make a business decision to maintain a certification. And this is, I'm sure, a medical device conundrum that occurs all the time. I can maintain my certification, or I can address a security issue. And now I have to make a terrible choice, type of thing. And so part of the discussion that occurred with the NIST advisory body was to ensure that the regulatory authorities both address security and ensure security is being addressed, especially in things like medical devices, but do it in a way that enhances and maintains security going forward, even in light and within the scope and the capacity of maintaining the medical device certification. Kevin, did I remember that right?
Yeah, I think so. And
Okay.
it predates a lot of not all, but a lot of the FDA
Yeah.
regulatory activity
Yeah.
and
Yeah.
agencies. Okay.
Absolutely. Yeah. Yeah. Yeah.
Anyhow, for those of you interested, go if you search for NIST ISPAB, ISP
PAB.
PAB, and probably medical device security. You can find this 14-year-old letter that you'll see some familiar faces there that
Yeah.
led to a lot of the regulatory changes.
And there were a lot of like really good briefings back then on the time from organizations like CDRH and ONC and VA, as the issues that they were wrestling with at the time around that as well. Yeah.
Okay. Well, I'm going to turn to the other side of the coin now. We have a PQC question.
Okay.
So there's a funding agency, ARPA-H,
Uh-huh.
and they have a program called Delphi on post-quantum chips for medical devices.
Okay.
So
That's great.
without any knowledge of that program, if you don't have any, but just any thoughts on how this might be useful for other agencies, just generically?
Well, yeah, I mean, first of all, that's awesome. One of the long tails in the transition is definitely hardware. I mean, software, if there's space and capacity within software, will be a lot easier to flip than things that are dependent on hardware or hardware accelerators. I suspect I don't know medical devices well, but I suspect medical devices have similar constraints as other, kind of small state transition IoT type device machines as well. So I think something like that could be extraordinarily helpful to other type of, small device communities that need to have or are hardware based just because they have a constrained environment. So yeah, I think that would be awesome. There's still going to be a requirement, at least for the U.S. government, that we get those tested to make sure that they're doing it right. So you will have to do a conformance test if it's going to be used by the government. But that's awesome. Yeah, Yeah,
And
that
I'll just say for anyone on the call, attendees who are working in this space of post-quantum resistant technology, let's say in some of the chips you're using for implants or bedside, feel free to reach out at Archimedes at northeastern.edu. We have an active summer research program in this space where many of the students are working on these subjects, mostly VLSI design engineers, a little bit on the security side, but building and taping out new chips in this space, and we welcome interest from the industry and other folks out in the community.
yeah.
Um, let's see. I think we have time for maybe half a question more. So I see we've got one about product development. It sounds like there's a product developer, and they at the end of the day they're looking for some standards compliant library. So
Oh, okay.
where do they even start to look for PQC navigating that barrier of entry?
Yeah, if you're looking for some reference libraries or reference implementations, I would start with the NIST PQC website. There are some standard reference implementations, I believe in straight C, on the website. There's also what's a PQC forum that you can sign up for. It's a Google group. There are some academics and some implementers on the forum that have published some Git libraries of different implementations in different languages. There's a couple of C and Rust and a couple of other ones there as well of all the different standards at the different kind of security levels as well. Kevin, I can get you a link if you want to some of those libraries.
Sure. Sounds good.
Okay.
And unfortunately, we have run out of time for this seminar. And I see there are a lot of other great questions. You're certainly welcome to mail the email address Veronica just posted in the chat, Archimedes at northeastern.edu, if there are any follow-up questions. Matt, I just want to say it's a real pleasure to have you on the program. It's been great working with you over the last 20 years, and I'm really happy to see that in retirement, you're doing great things and keeping so busy. It's hard to get on your schedule. So.
Thank you, Kevin. It's been my pleasure, and I appreciate the opportunity to talk to an important community and especially evangelize on the upcoming PQC transition. So I appreciate that.
All right, PQC, Matt Scholl, and we'll resume in September with the fall semester on September 17th with Nastasia and Justin from FDA speaking in a Q&A session on cybersecurity policy. So in the meantime, stay secure, avoid 806 recalls, and I wish you all a secure summer. So thanks everybody for joining.